So let's talk about con laws. No, not corn laws. Those were repealed a long time ago. I said con. Nope. Once again, different con. We're talking about certificate of need laws. You've probably never heard of them, but they're present in most states. So how do con laws work? Well, before someone can open or expand the operations of a healthcare facility, a con law requires them to prove to a regulator that their community needs the new services. That may sound odd. Why get in the way of someone trying to provide more healthcare? But the original goal was to control costs by reducing spending on unnecessary treatments and equipment. Thanks to incentives offered by the federal government, every state except for Louisiana had a con law by 1980. But the con laws have not been a panacea for controlling costs. One reason is that obtaining a certificate of need is a pain. Recently in Virginia, a doctor spent 5 years and $175,000 trying to get approval for a second MRI machine. Con laws also make it hard for new healthcare providers to compete with established ones. In fact, established providers are often invited to testify against their would-be competitors in determining a community's need for more options. You can imagine how that works out. In light of evidence suggesting they didn't work, Congress actually stopped encouraging states to adopt con laws in 1987. Since then, 14 states have repealed them. If con laws aren't working to lower costs, why haven't they been repealed in every state? One reason is that many well-meaning supporters still believe that con laws encourage providers to use the bigger profits that they make from having fewer competitors to provide more uncompensated care for the poor. But recent research has found no evidence that cons increase care for the poor. They are, however, associated with fewer hospital beds and less medical equipment. So as you can see, saying goodbye to con is one of the first steps a state can take to make its healthcare market more competitive, dynamic, and focused on patient needs.